I'll warmly welcome on SRTV Lab.
Today I would like us to see what we call target heart rate and maximum heart rate. The difference between the two, how to calculate it, and what they indicate. Let's start with the maximum heart rate. Actually, the maximum heart rate is the maximum number of your heartbeats within 1 minute of effort. That is what we call maximum heart rate. Is the maximum number of beats made by your heart or heartbeats in 1 minute of effort. That is what we call maximum heart rate. Actually, the maximum heart rate is based on your age as subtracted from 220. So we are going to see the formula how to calculate the maximum heart rate based on the age subtracted from 220. So the maximum heart rate, or MHR, equals to 220 minus the age, and there is always a range for heart rate. So the range will be between 220 minus the age, so this number you subtract 10, up to 220 minus the age and add 10. That is the range for maximum heart rate. Let's take an example of someone who is 20 years old. The maximum heart rate will be 220 minus 20, which is equal to 200 beats per minute. Now let's see the maximum heart rate range. It is 200 minus 10 up to 200 plus 10. That is the range, which means the maximum heart rate should range from 190 to 210 beats per minute. This is the maximum heart rate of someone who is 20 years old. Now let's see the target heart rate. So actually the target heart rate is the range, do you get me, is the range of numbers that reflect how fast your heart should be beating when you exercise. Do you get me? The target heart rate is the range of numbers that reflect how fast your heart should be beating when you exercise. That is what we call target heart rate. And this target heart rate is actually generally expressed as a percentage, and it's usually between 50% and 85% of your maximum heart rate. You remember how to calculate the maximum heart rate: 220 minus the age, and there is always a range. As for the target heart rates, there is a range. Even on the maximum heart rate as well, there is a range. So when you are doing exercise, you can monitor your heart rate and try all your best to reach your target zone or your target heart rate. Now let's calculate the target heart rate practically. You have to explain to your client of what you are going to do. And the first step is to measure blood pressure and heart rate at rest, to know what is going on in the body of our patients at rest. So here we are using the automated blood pressure monitor, because it's going also to be the best tool during exercise. You cannot use
Korotkov method or oscillatory method during exercise. So this automated monitor is the best choice. Now let's calculate and see the result at rest. Good. And you remember how to calculate the target heart rate is the percentage of the maximum heart rate. The target heart rate, remember, according to American Association of Diabetes and Cardiovascular and the CDC or Center for Disease Control, the target heart rate should be between 50% to 85% of the maximum heart rate. Good. Here the resting heart rate of our client is 66 beats per minute. That is his resting heart rate or heart rate at rest. The next step now will be to ask him to ride a bicycle to see what will happen on his heart rate. We are going to see, is he going really to reach the maximum heart rate or the target heart rate? Let's see. So our client age is 35. This means his maximum heart rate should be 220 minus 35, which is 185. That is his maximum heart rate. Now let's just adjust this seat of the bicycle at his height. Good. The seat should be at the level of the waist. Good. We have done it. We have adjusted the seat. The next step is for him to do what? To sit on the bicycle and then ride it. And after every 2 minutes, we will add more weight. This bicycle is called ergomedic bicycle. It has some weight that you put on it and then you increase the resistance. Good. Also, you should adjust the handle so that a patient will not lean forward too much. Also, a patient will not be erect. So we should bend forward a bit and his elbow should be extended. Another thing, he has to follow the pace of 1 just cycle per second. Good. Another thing is just to encourage him to keep riding. Now there is no weight. We are going to wait up 2 minutes and then we add any weight. Good. Remember, let me repeat once again. The maximum heart rate is 220. That is a formula. 220 minus the age. And he's 35. 220 minus 35 is 185 beats per minute. That is his maximum heart rate. Also, you remember the heart rate changes as well. So the range will be 185 minus 10, which is 175, up to 185 plus 10, which is 195. So his maximum heart rate range should be between 175 up to 195. Then we will calculate his target heart rate according to the maximum heart rate. So when you calculate, you will see, according to NCDC or National Center for Disease Control, that is American Center for Disease Control, the target heart rate should be between 50% to 85% of a person. That is the target heart rate. Now, as our client now, maximum heart rate is 185. His 50% of the maximum heart rate is 92 beats per minute. And then 85% of his maximum heart rate is 157, which means his target heart rate should be between 92 up to 157 beats per minute. Good. Now, we don't stop encouraging him. Let's keep encouraging him. Please, go. You encourage him so that he doesn't give up. But remember, if he feels any pain, we have to stop the exercise. You get me? If he feels any pain, we have to stop the exercise. So now he has to keep riding. Yes, go. We are adding some weights so that the resistance might increase. Good. Let's go. Let's move. Let's move. Another thing that you should know is that when you are a sports person, if you are not able to reach your maximum heart rate, that means you are not physically fit, and you can improve up to the point you will reach to your target heart rate. When you reach your target heart rate, that means no more performance to be expected from you. But if a person also reaches his or her maximum heart rate just in a few minutes, that means that person is also fit. Is not fit, because there is no gap to improvement. But if you are a sports person and you do exercise and you still have the low heart rate, that means you can keep doing exercise and then improve yourself up to the point you reach your target heart rate. That is good. Also remember, the target heart rate is good. When you are doing exercise, you do all your best to achieve your target heart rate. Good. Let's go. Let's keep encouraging our patients to ride. And remember, you have to record somewhere the result. Like we have recorded his heart rate at rest. And you remember, it is a 66 beats per minute. Then we'll see his heart rate at the end of the exercise to see if there is any changes. But we are expecting changes. In which way? We are expecting his heart rate to increase. But let's wait and see if it is really going to increase. Let's be patient, but we don't stop to encourage our patients to keep riding. Ride, please. Ride. Yes. He has to keep riding. Yes. Remember, our goal today is just to show how you will know if a person has reached the target heart rate, even the maximum heart rate. So how will we know if this gentleman has reached his target heart rate? Remember, his target heart rate range should be between 92 to 157, which is 50% to 85% of his maximum heart rate. Let's add one final weight. Yes. So after a few minutes, like 2 minutes, we are going to check his heart rate again and his blood pressure. So we are expecting his heart rate to increase. Also, the blood pressure will increase as well. Good. Well done. Keep moving, guy. Keep moving. Yes. Don't give up. Don't give up. If we say he's totally exhausted, we're gonna stop the exercise and measure his heart rate and blood pressure as well, using our automated blood pressure monitor. Now let's take the monitor. Good. Remember, his heart rate at least was 66 beats per minute. Now let's see. Let's see. Now he has to stop, and then we measure the blood pressure and heart rate. Let's see what is going to come out. Good. See here. Good. We are asking him, is he feeling tired or pain anywhere? He's tired but no pain. Good. Let's see. Remember, if we find his heart rate is lower than 92, that means he has not achieved his target heart rate minimal range. But if he has also gone beyond 157, that means he has gone beyond his target heart rate. So his target heart rate should be between 92 to 157. Now, oh wow, good. His heart rate now is 122, which is good. It's between 92 to 157. This is so good. But as he has not reached yet 157, this means he can also keep doing exercise and reach up to 157. That means he'll be performing at his maximum. That's good. So, like if he's a sports person, he should check his heart rate and do exercise at 157. Now let's see where we have recorded. Do you see at the beginning his blood pressure was this 119 over 71 millimeter of mercury. His heart rate was 66 beats per minute.
So guys, thank you for watching the video. I hope it's very helpful. So please don't keep this information just with yourself. Share this information to your colleagues, and see you in another video next time. May God bless you abundantly. Please support this channel by pressing like, subscribe and the bell. This is a huge support for this channel. May God bless you.